a patient who undergoes a major heart operation can recover extremely fast. I just want to briefly tell you how robotic surgery can be extremely useful to somebody who requires heart surgery. I know robotic surgery is very new, it's just into the market now, and we are practically the only center that does robotic heart surgery in this whole country. There are very few centers across the globe as well. Now, in robotic surgery, what we do is that we make very small holes. They're basically 8 millimeters in size. They're called ports. And through these ports, we put the robotic arms, and the surgeon actually sits about 2 or 3 feet away from the patient and then uses the robot to operate. The robot does not operate by itself, so there is no fear for the patient. Basically, the surgeon controls the robot through a console by sitting far away, about 3 or 4 feet away from the patient. Several advantages for the patient. Basically, there are no cuts except for these small 8 millimeter ports through which these fine instruments go through. Because there are no cuts, the chance of an infection is extremely low with robotic heart surgery. Also because these cuts are so small, like I said, 8 millimeters in size, not even a centimeter, 8 millimeters in size. And because these holes are so small, the pain of surgery is practically eliminated. Again, because these holes are so small, there is practically no blood loss, which means that a patient who undergoes a major heart operation can recover extremely fast. Currently, we do robotic surgery for valve replacements, for valve repairs, for closing holes inside the heart. We also do robotic surgery or robotic assisted multi-vessel bypasses. These patients basically stay in the hospital for 24 to 48 hours. Most of them don't require any blood transfusion. And like I said, most of them have absolutely no complications and are fit to go out of the hospital in 48 hours and resume their normal activities. And that is the beauty about robotic heart surgery. There is a lot of fear in the minds of the people about robotic heart surgery. Many doctors themselves don't know about robotic heart surgery, but the robotic heart surgery in trained hands, in somebody who's been doing minimally invasive. For example, my own minimally invasive experience is about 15 years now. And for somebody like me, doing robotic heart surgery is as safe as minimally invasive surgery. So in our hands, robotic surgery is very safe with success rates over 99.5%, which means, for most patients, it's a very good operation to choose.